Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. It's November, and that means Epilepsy Awareness Month. Our guest in studio is returning to talk with us, Dr. Ahmed Abdelmoity, Director of Children's Mercy Hospital's Level 4 Epilepsy Center in Kansas City, Missouri. And he's returning to talk with us about, some quality of life issues as they relate to treatment options and comparing some of the different therapies that are available for those that are living with epilepsy. Welcome back to Health Professional Radio, Doctor.
Thank you so much. Thanks for having me again.
Thank you. November being Epilepsy Awareness Month, is this the first awareness month that you've been personally involved in?
Oh, I've been involved in so many epilepsy awareness months over the years, through either epilepsy walks or more awareness, demystifying epilepsy, and epilepsy is a passion of mine.
Many people aren't as familiar with epilepsy as they may think that they are. Now, epilepsy, it involves, I guess, frequency and types of seizures. Am I correct in that?
Yeah, absolutely. You're absolutely correct in that.
And there are several misconceptions surrounding epilepsy. One of the main ones in discussions that we've had before being a misconception about the quality of life that someone suffering with epilepsy can expect. And I guess sometimes suffering may not be the proper word. Living with might be more appropriate. Talk about some of the quality of life issues that you strive to address when you're dealing with your patients who have just recently been diagnosed or may have been living with it throughout their life and they've now transitioned into a different age group.
Yeah, epilepsy, as we talked last time, is not just seizures. So there are a lot of comorbidities or a lot of factors that happen and live with epilepsy, some of which are related directly to the seizure and the seizure frequency, and whatever we can do to lower and minimize that, it directly helps those side effects. But others are coexisting with epilepsy. So some of the ones that are related directly to the seizures are the seizure injuries, and those can be falling down, having head bleeds, having lacerations, sometimes having fractures, having dislocated joints. Increasing healthcare utilization, coming to the hospital more frequently, coming to the emergency department with the inconvenience that can cause to the family, the cost, the ability to hold a job, staying at school, and so forth. Increasing mortality and morbidity. So there is premature death with epilepsy, which is something that I make sure my patients are informed about, and it's not to upset them, it's not to depress them, but it's also to make sure that they're well informed and they understand the full extent of the syndrome. Or the more seizures I have, or the less seizures I should say I have, the less likely I am to have the premature death that can be related directly to epilepsy. Some of the other coexistence with epilepsy are depression and anxiety. Those are happening in some literature. Upwards of 50 to 70% of patients with epilepsy can have depression and anxiety. Sleep disturbance, either inability to fall asleep or with insomnia and recurrent waking up in the middle of the night, which is not an uncommon thing in patients who are having epilepsy, with their EEG and with their electrical activity of the brain are so active that even prevents a natural good quality of sleep, but also can be related to some of the side effects of medications that makes the patient sleepy and sleeping most of the time. Cognitive and memory impairment is another coexistence with epilepsy, and that's a part of the epilepsy syndrome. Some of it are related to the seizures and the epilepsy itself, but others can be related to some of the side effects of medications. As you probably have noticed, I've mentioned side effects of medications a few times now. So the side effect of medications itself is part of the epilepsy syndrome, where you have number of kidney, liver, bone density problems that can happen with seizure side effects. Some impaired abilities to obtain education, work, maintain a job, ability to drive. If we look at the laws in most states in the United States, they have some limitations for the number of months before a patient with seizures, a patient with epilepsy, or a patient who has loss of consciousness event can go back and drive. Establishing families, developing and maintaining social relationships. So, as you can tell, seizure is an important part of epilepsy, but that's not the only part. Every single one of the points that I mentioned becomes part of that patient's quality of life, which makes it directly related to epilepsy, which makes it under the umbrella of the epilepsy syndrome.
Well, something like this that has so many different aspects and different layers of causes, treatments, quality of life issues. There must be a myriad of treatments available out there for different types of conditions. Talk about maybe the top 3 or 4 that you can compare that would improve greatly the quality of life for someone suffering from epilepsy, say across the board from the first couple of years of life into their 70s.
So again, studies have shown us over and over again that the first, second, and at sometimes even the third line of treatment has been medication. So in about 2/3 of the patients, we're able to get epilepsy better controlled, or the seizures better controlled, with some improvement in all of those factors by medications, 1, 2, maybe 3 seizure medications. But that leaves about 1/3 of the patients, about 35% of the patients with epilepsy, whose seizures are not going to be responding, are not going to be stopping to those 3 seizure medications. So if we take statistics in the United States, with the prevalence of epilepsy, roughly about 0.8 to 1% of population. So we have roughly about 3 to 3.3 million people in the United States with epilepsy. That's across all age groups. If we take the statistics that we just talked about, then I have roughly about 1,900,000 to 1 million people who have refractory or drug-resistant epilepsy, which creates a very, very important need to go outside the pharmacological treatment. So some of the top pharmacological treatments that we have, some of the non-pharmacological treatments that we have are epilepsy surgery, and this is for a very special group of patients in whom the seizures are focal, coming out of one focus. We can identify this focus either through imaging, either structural imaging or functional imaging, and through EEG, and those are patients who can go to the operating room and potentially do a surgery that would help their seizures. That is a very specific and very specialized subgroup of patients, which leaves a bigger majority of the patients out of that 1 million that I just mentioned who have refractory epilepsy, who unfortunately surgery might not be an option for them. In that case, there's neuromodulation. This is when there are certain devices that can be implanted in the body. Vagus nerve stimulator is the first approved here in the United States to address that, and it sends electrical signal to the vagus nerve, and we know from the clinical studies that about 2/3 of the patients, their seizures got better by at least 50%. But on top of that, their quality of life has significantly improved. So now I'm not just treating seizures; I'm treating the whole epilepsy syndrome. I'm treating the whole patient as a whole. The third type, or one of the other types, is a ketogenic diet, which is a very special type of diet, high in fat content, low in carbohydrate. And that changes the chemistry of the body, introducing more ketones with beta-hydroxybutyric acid, acetoacetic acid, and acetone. Those are alternative fuels for the brain, which helps improve seizures and get seizure better controlled. That last type of modality, it's more commonly used in pediatric age group. Okay. Teenagers and older patients, it's not as easy to maintain such a strict diet.
A lot of legislature in this recent election surrounded marijuana use in several states. We happen in the state that is dealing with medical marijuana, or I guess cannabinol. Is that the correct term for?
Cannabinoids, yes.
Is that something that here in the Commonwealth of Kentucky, 2 of our learning institutions are experimenting with these oils for pediatric seizures? Could you speak to that just a bit, as far as pediatrics and adults as well using medical marijuana?
Yeah, absolutely. So, and again, part of the problem, which is we have to really identify and address, is that we still have 1 million people in the United States who have drug-resistant epilepsy who need a treatment beyond the medications they're taking. If their seizures are happening more than 1 seizure per year, despite being on these 2 or 3 seizure medications. Some of the things that people have tried to reach out for is medical marijuana, either the CBD or the hemp oil as a whole oil, and so forth. There are a few issues with that. Number one is we got to understand it's still a chemical, so it's still almost like a drug. Yes, I understand it's natural, which seems to be very appealing to families and to parents, as well as to patients as well. But very little is still understood about the mechanism of action, how it affects other medications, which is another very important thing. Like we agreed, we look at the patient with epilepsy as a whole. We cannot just isolate seizures and throw everything out. But also, if we look at some of the recent studies that were done that showed that about 1/3 of the patients with epilepsy got to that 50% or better improvement in seizures, which if we compare that to a lot of medications, and again, if we just look at the numbers, just pure numbers, we're going to find that it's quite similar to that next medication. So like we agreed, timing is really a key here. So I cannot just keep doing what hasn't worked with my patient. So there's a lot to be understood. We don't know the pharmacokinetics of CBD and hemp oil yet. We don't know the proper dosing. We don't know the long-term effect. We don't know, is it going to be a honeymoon period where patients are going to come back to having more seizures, the same number of seizures? Is it better for different types of seizures than others? All those are questions that need some answers before I can simply write a prescription, give it to my patient without knowing the full extent of the side effects. But the three that are well established and well understood and well studied, like I mentioned, for a small subset of patients, the surgery. For another very special group of patients is the ketogenic diet. Then neuromodulation, either the RNS or the vagus nerve stimulator, the RNS, where I am not just addressing the improvement in seizures. Like we agreed, 2/3 of the patient's seizures better by 50% or more, which in a lot of cases allows for weaning some of the medications off as seizures get better, which is not a promise that I make to my families, but it's a fact that I am able to do with most of my patients after they implanted with a device. Improvement in academic performance, alertness, quality of sleep, ability to maintain a job, reducing the healthcare cost. So how many times I'm going to the emergency department? How many times I'm being admitted to the hospital because of seizures? How many times I'm visiting my neurologist and my doctor? All of those are things that have been shown to be reduced after the vagus nerve stimulator, the VNS, was implanted. One of the other things that was not too long ago published is showing the risk of SUDEP, something we talked about a couple of times ago, the sudden unexplained death of epilepsy in patients with refractory epilepsy. That number got reduced by 67%, 2/3 in those who had the vagus nerve stimulator for a couple of years. So I'm not just improving seizures, but I'm also saving lives by improving seizures, by improving quality of life. So past that second or third medication for somebody who's not a resective surgical candidate in my center, if the patient meets those criteria for VNS to be implanted, I present the data for the family, letting them understand the improvement in seizures, improvement in quality of life, the lesser risk for SUDEP. There was another study looking at, what if I just add another medication or add VNS in a patient who's failed 2 or more seizure medications? And the numbers were really striking as far as quality of life improvement significantly higher in the VNS group. Not just that, the seizure improvement continued to be cumulative and maintained across the 12 months after the implantation, as opposed with medications. Past that second medicine, the likelihood of just having a honeymoon period for 2 or 3 months, then going back towards seizure is more likely.
Now, one final question, Doctor. Where can our listeners go and learn more about epilepsy and the Children's Mercy Hospital's Level 4 Epilepsy Center?
That's a really good question. So really sources of information is very, very important because as great as the Internet is, it can sometimes mislead patients and even healthcare providers. So some of the, our website is www.childrenmercyhospital.org, and right there you can type the Epilepsy Center or Epilepsy Clinics, and it'll take you to our website, which has a lot of information about epilepsy, about treatment, about services that we offer. But in general, Epilepsy Foundation in general is a good place to go to. Epilepsy.com has a lot of information about epilepsy. Just make sure that you've got a trusted place that has valid information, unbiased information about diagnosis of epilepsy and treatment of epilepsy and different treatment options for epilepsy.
Great. Well, it's been a pleasure talking with you today, Doctor.
Thank you so much, Neal. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Ahmed Abdelmoity, Director of Children's Mercy Hospital's Level 4 Epilepsy Center. And he's been with us discussing some of the treatment options available for those that are living with epilepsy and comparing some of those options as they offer a quality of life improvement across the board. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.